and signs for your ride. SignBros is the place where we make your signs.
Hello.
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 That's okay.
How's it going? We are the SignBroCast. Welcome to our podcast. We've been taking a short break, but we're back. And make sure to subscribe on the link below. And with us today, we have Dr. Leo Altenberg.
Yes,
Thank you for
sir.
joining us from your busy schedule, Doctor.
Thanks for inviting me.
Yeah, good morning.
Thank you. Thank you for being here. From the Men's Health Clinic. Is that the
El Paso Men's Clinic.
El Paso Men's Clinic? Yes. Well, thank you for being out there in the front lines. I'm not sure how much direct contact you have with all this stuff that's going on, but we appreciate you for being out there.
Yes, sir. Thank you, Doctor.
Thank you.
Yes. Tell us a little bit about the Men's Clinic.
Well, I started El Paso Men's Clinic to provide a place for men to feel comfortable to get their health care. We kind of attract them to the clinic with treatments for erectile dysfunction and low testosterone. And then while they're there, we check them out pretty well to make sure that their blood pressure and diabetes and other conditions are well controlled before they can get any testosterone, and screen them out and make sure they're being followed by a family doctor or some physician, which half the time they're not. So we can continue to follow them even for just their routine medical care as needed.
Got you. And that being, you're able to stay open during all this whole time. I mean, I would think that erectile dysfunction and low testosterone is not really like a priority, but is it? I mean, no. I mean, during this time.
Oh, okay.
During this time.
Well, we don't just take care of erectile dysfunction and low testosterone. We
Cover it
follow
all.
people for their medical conditions, so we keep, we have to refill their meds, and we keep seeing them. And some of them are truck drivers, so they come and go out of town. So
that makes sense.
and there's a lot of other things that come up. We also started telemedicine, so that people that can't come in can, we can see them through cameras.
Yeah.
And if they feel like they have a viral syndrome or something that might be COVID, then we can see them without them coming in, and we can order some testing as needed and make sure that they're doing well and they don't have COVID, basically.
Gotcha.
Wow.
Now, real quick question for you on the. Can you give us some examples of low testosterone? What are some symptoms, or what is it?
Well, low testosterone, men complain of low libido, fatigue, sleeping more, maybe some joint aches, weight gain, or unable to lose much weight even though they're working out, trying to gain muscle, but having trouble doing that or losing weight, and they're kind of stuck. And so generally it's coming on in your 40s and 50s, but some guys get it earlier, and it seems to be associated with some familiar genetic conditions, inherited conditions like diabetes and hypertension and sleep apnea. So those are things that we're screening for, trying to get men to make sure, if I have a concern that they may have one of those conditions, we screen for it while they're there getting their testosterone checked, and we have them go get treatment as needed for sleep apnea, or they can be followed in our clinic.
And everything's done there in the clinic, or you said something you send them out for low testosterone can be taken care of there?
Yes, we have treatment for low testosterone. We use pellets, bioidentical testosterone pellets that we implant under the skin, and those release testosterone slowly over a 6-month period. So by 6 months, they're absorbed up, and then we put in another round as needed and see if, well, generally their testosterone level will come back to where it was, but sometimes they seem to get better if they're doing, controlling their conditions, exercising more, and
wow.
But generally they come back because it makes you feel a lot better if you're on if you have a low testosterone and you get it, you noticeably feel better with the testosterone level up. And so when you're young, your testosterone is very high, and so as it goes down over the years, you start having symptoms. We put it back up to the level of when you were young, like maybe at 900 or something like that, and they drop down to 300 or 200, they're really having symptoms.
Gotcha. So like 900 would be like a 19-year-old, 25-year-old?
Yeah, a 19-year-old probably.
Shit. Wow. So you get when your numbers go back, you have the same sex drive as when you were like 19? Or you should?
Well, maybe not quite.
Then you gotta watch out
the
for
mind is wanting, but the body can't.
Then you gotta watch out for heart conditions after that, right? So you mentioned a lot of symptoms of physical, like the laziness and all that stuff. What about the emotional stuff that when it comes to testosterone, low testosterone?
Well, some guys have anxiety. Yeah, they can have seems like anxiety is associated with it more than anything else, and difficulty sleeping, and just fatigue, overall sense of sort of malaise, not really energetic. As far as depression, it's hard to tell whether they have that from low testosterone or whether they have depression, just inherited depression.
So can this cause a man to have like mood swings and stuff like that as well, personality wise? I guess I'm trying to equate it to women has their particular menopause and stuff like that too.
Yeah, the hormone replacement treatment is very popular with women. Those are postmenopausal women who have a lot of hot flashes and difficulty sleeping, anxiety. So most of the treatment with these pellets, hormone replacement pellets, are for women. So only maybe a third or nationwide men are involved. But so it's not as dramatic in men as in women. It seems more subtle, but when your levels really drop low, which doesn't happen that often, if they're like 100 or very, very low, it's really tough. Guys are really having trouble when they're that low, and so they feel much better, they have much more energy and activity.
Okay.
We couple our treatment of if there's erectile dysfunction, testosterone does help that. It helps the libido to some degree, but if it's rather more than mild, we use other treatments. We use the low intensity shockwave treatment to the penis, and with something called a P shot or a PRP injection into the penis.
Wow. Yeah, that doesn't sound comfortable. These guys are very curious. They're asking me about erectile dysfunction. Just kidding. Is there more to just Viagra, the little blue pill, or is there other stuff besides the shock treatment? Or is
the low intensity shockwave are impulses. They're not electricity. They're just impulses. There's like sort of like lithotripsy, started by a urologist, and so there's 6 treatments that go in a package, and takes about 20 minutes each time. We do it twice a week for 3 weeks, or try to get all 6 in a month.
That's the shock treatment?
Yeah, the shock. But it's not painful at all. It doesn't have any pain. is just more or less
Stimulating, kind of.
stimulating, trying to open up arteries, arterioles in the penis, get blood flow.
Wow.
And then we give that P shot, that PRP injection into the penis, which does a similar.
We all cringe at the same time.
Well, it does a similar thing to the shockwave treatment. It opens up arterioles, but what we do is we draw out the patient's blood about 2 ounces, and we spin it twice so that we have a very concentrated solution of plasma with platelets, of the patient's platelets. Put a little bit of calcium chloride in it that opens up those platelets, and those are the healing factors that come out that are used to heal your tissue when you're injured.
Wow.
So it opens up, it attracts stem cells, but it's very long. It takes a long time for it to really kick in. It takes like 2 months. So you have to have patience in this treatment, because it sort of keeps getting better over the first 3 months.
Gotcha.
In the shot, we use a topical numbing cream, and there's a local penile nerve injection with some lidocaine, but not into the penis, at the base of the penis, and to numb up the penis. And it really doesn't hurt. I mean, it feels like a little pinching, but it's not as painful as it sounds.
When it comes to erectile dysfunction, I think ED is what they call it for short. Physical parts that affect it as opposed to emotional or mental. I heard that sometimes people with a lot of trauma or something that might affect stuff like that, the physical.
Yes.
Or is that?
Yes. No. I mean, certainly with anxiety or PTSD or it just doesn't even have to be that severe, but
really, wow.
Just a performance anxiety is very common, where they, things aren't working, and then they get, before sex, you get nervous and it doesn't work. It doesn't. So all that can interfere. So
so do you guys help with that part of it, like emotional? Do you guys have like counselors for that, or are you guys just still with the middle part, or how does it work?
Well, no, we encourage counseling. I mean, it's really hard to get a man into counseling.
Well, I would think that it would be even hard to get a man to go in to try to even talk about it in the first place. I mean, I would think it's something. I would think that it's something that's just, I mean, you just don't want to face.
Yeah, well, yes, and we have, through advertising, we encourage him to think about it, and but in our clinic, I mean, that's why everybody's there, so it's not like this is unusual.
Yeah.
A lot of times they've been to a doctor, and the doctor says, here's some Viagra, and it doesn't work, and they're just sort of battling with it for a long time, and then we come up with different solutions. We have their testosterone may be very low. I mean, that may be contributing to it, and they don't know it. And so we're looking at all the possibilities and trying to point them to some solutions. And they also, a lot of times, they'll have premature ejaculation, and that's kind of easily fixed with, there's some medication for that seems to work quite well. And it also reduces anxiety. So, these things aren't that difficult to work on.
Gotcha.
And our treatment doesn't always work, but it seems to help a lot of men and get out of that routine, especially if they get the testosterone, the P shot, the gains wave, and then they're really getting better over a period of 3 months, and generally you can get back into their old ways.
During this COVID-19 pandemic, have you experienced like an upswing in walk-ins or customers, as far as like people walking in to get checked, or
for viral illness, you mean?
Right.
Not really. I think we really slowed down in April. Like, there was nobody was coming out, and there was no testing. I mean, what could we do? There was not. And now we when we do have somebody calls that's worried that they have COVID, we can send them somewhere to get tested. We have testing sites now,
Right.
so they can find out for sure one way or the other. So we haven't really been overrun with a lot of COVID cases. We've had a few that I thought might be COVID, but I don't think any one of them turned out to be. And but I think because of the fact that we were on lockdown for a good period of time, there just haven't been that many cases. We're not overrun here with COVID, and so that's been very good for all of us. That that it hasn't run rampant and overloaded the healthcare system. And right now, I think we're in a sort of a medium range of cases in the city. It's not low, it's not high, it's just sort of cruising along. But I think people still have to be careful and shouldn't be out and much. And we still should be basically in lockdown, I believe.
Going back to the clinic stuff, you all take care of vasectomies and all that stuff as well.
Well, we do. We're not urologists. I'm not a urologist, but we do. Vasectomies are in the realm of primary care, and so for some doctors, I've been doing vasectomies for many years. So yes, we do vasectomies in the clinic. We do a minimally invasive vasectomy, so it's
not that bad.
Can be done in the office with local anesthesia and
good, because Nathan's got a lot of questions on that one.
I think I'm gonna sign up for this.
I think he's the curious one of all this.
That's true. I'm not kidding. I do need a vasectomy.
Maybe the next podcast you could do a live actual
vasectomy online.
Another camera over here. I was in a what about women's sex and it's women's low sex drive? Do you guys take care of that as well?
Yeah, well, we do have, like I say, the women are, generally they go to their gynecologist, and the gynecologists do the same thing. They have the hormone replacement. We have some small doses of testosterone for women who need like some additional sex drive, but haven't had that many women clients really, because of the gynecologists around town are doing it so much.
The women are probably a little bit more comfortable with their gynecologists.
And they get their pap smears there, and they can do the hormone replacement. And there's a lot of options for women too. There's a lot more options than there are for men.
I believe that.
Yeah.
They always have more options.
Of course.
Clothing, shoes, doctors. Now, question back to like when it comes to like Viagra and stuff like that. What are things that people have to be worried about? Like instead of just hopping over to Mexico and buying this, buying that, and using that, is there some stuff that people should be aware about when it comes to stuff like that?
Well, yes. I mean, if you have, it's not been. I've not found over the years that it's been terribly dangerous to take the erectile dysfunction medication. That's why they're doing it online. They're giving it online. But if you don't have any heart disease or severe medical problems, kidney failure, and things like that, I mean, it's generally you screen out for those things. It's generally pretty safe. It can lower your blood pressure, and so when you take it, I mean, if you have some underlying condition you don't know about, basically, I mean, there is some possibility that it could cause you to have chest pain or pass out from low blood pressure, because it's It was initially those medicines were thought to be potentially high blood pressure medicines, but they didn't turn out to be good high blood pressure medicines. But men were starting to have erections with them, so they became erectile dysfunction medicine.
Gotcha.
Yeah, that's
Gotcha.
good.
Okay.
So so it could lower your pressure, but we haven't had any trouble with them. We have the option of getting generic sildenafil and tadalafil Cialis, and so it's very inexpensive to get those generics here. So there's really no reason to go to Mexico and buy it because it's it's available. It's not, they're not charging you $20 a pill or anything like nonsense like that.
Oh wow.
So, we use those, and as a matter of fact, they are part of the treatment after you get the P shot. We want you to try to have more erections every day. So we have people take tadalafil, and we have them use a penis pump to bring blood into the...
Get it out. Yeah.
Unwelcome guest.
Yeah.
That's going to bug you. Let's get it out of here.
Wow, interesting. So, do you guys have a website and all that stuff? Of course, we can make sure we put it on the screen.
Yeah, ElPasoMensClinic.com. Yes,
Okay.
We have a very extensive website in Spanish and English, and it shows all the different treatments we have. Plus, we do general medical care. It's generally targeted toward men, but we can take care of women too, and we do have some women patients for general medicine.
Very good.
Excellent.
And do you speak Spanish as well?
Yes.
Do you really? Excellent.
Yeah.
Oh, nice. Very good. And we want to know more about you. Are you from El Paso originally?
No, I was born in California. And lived in Southern California until I was 9, and then we moved to Panama, the country of Panama.
Wow.
Nice.
My mother's Panamanian.
Gotcha.
Nice.
And
That's where you picked up your Spanish?
yeah, I started learning. I didn't speak English and Spanish in California, but started learning when I was there, and then studied it till forever.
Wow.
And I studied some for about a year in Mexico, so I learned more there. And I came back here to work after college to Texas, and I later went to medical school at Texas Tech. So I was in Lubbock for 2 years, and then here in El Paso was Thomason for 2 years of my clinical training, and then went to do family medicine in Fort Worth in residency, and then I worked in Texas in various places, but I really liked living here. My sister had done an internship at William Beaumont. She was a medical technologist, and when I came to visit her, and I really liked it, so came
Stuck
back.
around.
Yeah.
Nice. Excellent.
Very good. And where in California, if you don't mind me asking? Where we at?
I was born in Los Angeles,
Okay.
and then also lived in El Centro.
Okay.
El Centro's on the border by Calexico.
I don't know that one. Okay.
It's way south.
Yeah,
Sounds
it's on
like
the border by
San Diego?
Mexicali,
Okay.
Calexico. It's Imperial Valley. Anyway, my dad worked at a junior college there. He was a junior college professor.
Very cool.
Excellent. Well, I mean, we're glad you're here in El Paso.
Yeah, definitely.
Some great stuff.
And the wellness center, was that already? Did you come to start working for them, or was that something you helped create, or that was already around you? The wellness center, El Paso Men's
Paso
Clinic.
Men's Clinic.
Men's Clinic, yes.
No, I started it here just in 2018.
Oh, you started. Okay, wow.
Yeah.
Oh, 2018. Oh, so it's
wow.
pretty new.
Yeah.
Oh, excellent.
That was good to know. Good to know. Wow.
Yeah, so we've been, trying to. There were no men's clinic. I took the name El Paso Men's Clinic because there's no El Paso Men's Clinic. There are some men's clinics in town, but they're generally run by urologists, so it's really specially focused on urology. But ours is for, general medicine.
Gotcha. And are men's that specialize in what you do, are they pretty common? I mean, can you go anywhere and find that deal specifically with what you guys deal with? Or?
Yeah, nowadays there are men's clinics in all the big cities all over the country.
Because when they were talking about you coming, I said men's clinic. I don't think I've ever heard of a men's clinic before.
Yeah, well, it's sort of a new concept, but there's like different. There's been, one thing, the testosterone replacement was never popular until more recently, and there's been studies that show that it's not dangerous. There was a lot of talk about it causing heart disease and this and that, but bioidentical testosterone is not dangerous. It doesn't have any significant effects. It does not suppress your natural hormone axis so that you continue to function in a normal way. It's just bringing up your testosterone to a level of when you were young.
Wow.
So,
well, that sounds good.
Yeah, we could all use that. I did have a couple questions for you about this whole COVID thing. I know you're not like a viral specialist or anything like that, so we can't take any of your words. You're a general medical doctor, right? So a lot of things that we're going to ask you in your answers probably going to be your opinion, correct?
Right.
Okay,
right.
Excellent. My biggest thing is like, when and how do we use these masks? I know everybody's supposed to be wearing masks outside and stuff like that, but when is the right way and how is the wrong way to use these masks and gloves?
And gloves, yeah.
Well, I don't know if there's any wrong way to use the masks and gloves. I think that whenever you're going out, or they say or they demand that you wear the mask whenever you're going out, I would say whenever you're going out and you're going to be somewhere around people.
Okay.
If you're alone in the car, I can't see any reason why you should wear your mask.
Okay, perfect.
Did you hear that, people? Did you hear that?
Yeah.
I actually pulled up by someone who at a stoplight, and they looked at me and they put their mask on like I was going to hop in their car or something.
Yeah, well,
I guess that there's what I've heard about these masks is like, because there's people that use these regular medical masks, I guess.
Oh.
Well, like the medical mask, but they use the same one all day long. Is that okay?
yeah, I don't think there's any reason. I mean, why would somebody need to change their mask? Well, I'm thinking, well, if you're around COVID patients and all day long, your mask may become
Infected?
or there may be some virus on your mask, and then you need to throw it away when you're done, or they have a way to sanitize the masks. They have a machine there where they put a bunch of these N95 masks in there and they sanitize it and you can reuse them. But
those N95s are the ones that like the doctors use and stuff for surgeries, am I correct?
yeah, I mean they just, I think this is an N95. This is a Chinese N95.
Is it made by 3M or?
No, this one's made in China. But yeah, the 3M ones, they're sort of like a bowl, but they seal better. Okay, the N95 seal better.
Okay.
So there's N95 testing that you do when you're working in the hospital, and they have a testing system for the N95s when you're wearing it. They spray it around and they check for leaks and that kind of thing. So you're not getting the aerosolized virus into your airway because you have that N95 mask. Now with the regular masks, you can get the virus into your airway. They don't have the seal that the N95 has. But if you're out and about, I mean, if you're not in an ICU where there's a bunch of COVID virus in the air, I mean, it's really not necessary to have an N95. You can just, wear some protection so that you're not spewing out.
Gotcha.
You're not spewing out, they're not spewing out. So there's very little virus, if any, in the air, and you're keeping a distance so the virus doesn't really get to one another. So that's why they say 6 feet,
Mm-hmm.
and to wear your mask, a 2-ply mask, and don't, touching tables and chairs and things like that. And there is a possibility, although not that great, that there's virus hanging out on the tables and chairs and glasses and whatever might be in a building, but that's more probable in a place where there's a high population density, like in a subway or
Lowe's, Home Depot, places like
yeah,
that.
maybe like Walmart potentially, where there's a lot of traffic and people coughing, and then the virus may be aerosolized, and maybe it is on something, but it's still pretty.
The chances are pretty low that it's gonna pass on from.
Yeah,
that you're gonna
from
get
touching stuff, or but
Gotcha.
if you can't wear gloves, you can always use some sanitizer. Like if you go into a Walmart and use a sanitizer, when you leave, use a sanitizer, to get any virus on your hands from touching things that you might have bought,
Or if you wear gloves, I know there's people that wear gloves inside of Walmart and stuff. You touch everything, as soon as you're done, throw the gloves away, right?
Get rid of the gloves, but also wash your hands.
And wash your hands.
Yeah,
Gotcha.
afterwards. Before you put on gloves and after you take them off, you need to wash your hands.
Okay.
So
we can't use them inside out like I do. No, I'm joking. So, in your opinion, Doctor, how's El Paso doing overall as far as taking care of precautions and stuff? From what you've been out in public, are we doing a fairly good job? Or you think we could do better?
Well, I haven't been out,
so
I don't really know what's going on out there. I don't go shopping, or I just go from my house to my clinic and back.
Oh wow!
So I don't know. I don't see anything from the numbers of infections. There's like 750 active cases right now in the city, and I don't. It seems like that sort of waxes and wanes. It doesn't seem to go down or up too much. So it seems to me that everything's going fine. But I don't think it's time to start going to school and going to bars and going to movie theaters, even though they're opening up half open, a quarter
capacity,
open. I'm not sure that it's the time yet until we see the active case numbers going down, going down. Then I think it's okay, but I'm not sure, when or if that's going to happen, because we're subject to cross-country, international travelers, and so we don't know. I'm not sure if there's any way they can screen people coming into the country or for COVID. So I don't know. So it's just a lot of variables that are difficult when you're on the border, especially where there's a heavy international traffic going on. You don't know what's coming in. So I think the best thing to do right now for me is just keep doing what we've been doing for the last 6-8 weeks or 2 months. I mean, just keep doing it until we see that there's a perceptible drop in the number of active cases, and then the chances of coming into contact with it are going to be very, very, very low, and we can go back to our regular business.
Gotcha.
Do you see this COVID-19 as a seasonal thing, or do you think it's going to be part of our?
I think this is what's going to happen. We've had this happen before. Okay, this is not new. It's more infectious than other viruses. When I was a resident there was HIV infection. They didn't know what it was. You know, when I started as a medical student, it was coming out here and there, and so that scared a lot of people. I mean, so this is kind of similar to that. It's scary at the beginning, and there's a lot of overreaction. But this is very infectious. It's not as deadly. But over time, what generally happens is there's better understanding, there's more knowledge, and so things start getting better. There's fine little ways for things to get better.
Vaccines and stuff.
Well, just how to manage ourselves, where it's, you know, where people are really getting, how are they transmitting it, you know, where are the hot spots, where, you know, we already know that the hot spots are meatpacking plants, prisons, and nursing homes. So when they get improve the management of those 3 hot spots, probably it'll just get better with that, you know, improvement. They start testing in those 3 places, you know, then from that the rest of us will be more protected just from doing that. Now then after that there's new medications. I don't expect there'll be any medicines to stop this. Maybe like they have this new medicine, remdesivir, that is for hospitalized patients that are in ICU, that are on ventilators, you know, that'll help save some lives, but it's not going to help us from giving it to one another. That's going to be helped when there is the vaccine that eventually will come out, but you know, that's a long stretch. I think the main thing that's going to happen, that's going to help, is to get better at management of the hot spots that are really spreading it fast.
Gotcha.
You get control of that when they have better understanding of how to manage that. You know, over time they just get better and better at how to manage those kind of places. And then that will reduce the spread into the communities, and from there into the, you know, the rest of the state or country.
So this thought of everybody being locked up, you know, staying home, sanitize everything, and then, you know, 'cause there's a thought that if we do that too much and come out, then we're even more vulnerable to stuff like that too.
Our immune system
gets a
little
little
weak.
I've heard that argument as well too.
No, I don't. There's no reason that this is one virus. We got lots of viruses that we've been hit with over the years. You know, our generally immune system is working great. It's not going to change. It's the only people that are in trouble are those that have that have, you know, diabetes, you know,
underlying conditions.
Yeah, there's all kinds of rheumatologic conditions where they have to take medicines that really reduce your immune response. So those people are at risk, and but everybody else that doesn't have any of that, you know, it doesn't matter if you're laying low for, you know, if you lived your entire life in a mountain community where you didn't have anybody around you, then yeah, you do have you are susceptible to, because you've never been exposed to viruses, you know. So the American Indians, that Native Americans who were exposed to Europeans, you know, had never been exposed to these viruses like smallpox particularly. And
Sorry about that.
And so
there you go.
Yeah, I missed.
Anyway, we have plenty of immunity, I think, as a general population, and laying low isn't going to change that.
Okay. Just very good.
Any more COVID questions? Because I got one more thing about the clinic that I want to talk about.
Oh, you gonna set up your appointment?
Yeah. Well, yeah. That'll be after.
You think of anything?
Not right now.
No, I think
Okay. I wanted to ask you about this vampire facial that's been
Okay.
very controversial, and it's a kind of, I guess, a hot topic when it comes to this. What is a vampire facial, first of all?
A vampire facial is a facial using microneedling. It's sort of like small needles that kind of open up your pores, and with those little needle punctures into the skin, we apply the same thing that I told you about the penis, platelet-rich plasma. We draw the blood, we get some plasma, platelet-rich plasma, and we apply it after you've microneedled the skin to open it up. And that platelet-rich plasma encourages collagen strengthening so that your skin becomes tighter.
And it's your own blood, is that correct?
It's your own blood,
Okay.
yes. Now, the reason it was controversial is because the microneedling device has to be approved. It has to be safe. That's where the problem came in. When you're microneedling, the patient's blood went from there's a little bit of blood that comes from the microneedling. That blood can get into the inner workings of the device that they're using, and it doesn't get clean. When they try to clean it, it doesn't get clean because it's sort of hidden. Okay, that's where it came from. It was spread through the
dirty
from
needles.
one patient to another.
Gotcha.
Some blood gets into the device, and then it gets into the next patient. So there is a device that is approved by the FDA for microneedling. That's what we use, is the FDA approved device, because there's no way for it to the way it's engineered, there's no way for it to cross contaminate from one patient to another. The head of the device that has the microneedling comes off, can only go on one time.
Gotcha.
It can't, once you take it off, it can't go back on, and it's sealed from the main motorized portion of the of the microneedling device. So that's why the FDA approved it, was because they showed they did the testing and everything to prove that there's no way to cross-contaminate from one patient to another. But they call it the vampire facial because it's made from blood. And it does look a little bloody after they're done on the face. But it really tightens up the face and gets rid of blemishes, changes coloration, and makes your skin very smooth.
Got you. And I know the reason why it was controversial, because I know a couple patients got hit with some HIV, but as far as what I understand, it was just kind of dirty practice. Is that what it was?
Well, my understanding from people in the business of this microneedling is that it wasn't the way the person was doing it. It was the device itself that was to blame. Okay, those were not approved devices for like commercial use. For the cross contamination was due to the way that the virus can hide inside the device and then come back and infect someone else. So the person wasn't negligent. The only negligence was that they bought a device that wasn't FDA approved.
Gotcha. Okay. Just to clear that up, because I know it was a hot topic there for a little while.
And also clear up, it didn't happen at your clinic.
Yeah, of course. yeah. I think it was over in New Mexico.
So that is something that you guys offer then.
Yes,
I never heard of that. Okay.
We have the proper device, the FDA approved device.
Excellent.
That's very safe. I mean, that's the first thing. Make sure it's safe, and then after that, it does a very good job at doing the facial. People are very happy with the results.
How long does the actual procedure take? Curious.
Well, it takes, you have to draw the blood and everything, so the whole thing takes like an hour.
Oh, wow.
So
Interesting. Oh, never heard of that.
No.
Very good.
Do your research, buddy.
We'll have a live
Excellent.
facial too.
Yeah. I'll do a live facial.
It sounds like almost like a tattoo or something, like that type of
Yes,
the machine.
it's only a quarter of or half a millimeter
Wow.
of penetration. You know, when it's
Just enough to open up the pore.
Wow.
opens up the
Very
skin, gets rid of lots of blemishes and pimples and things like that. And
Does it do wrinkles as well? Wrinkles?
it tightens up.
tightens up
yes,
Botox-ish.
Wow.
it tightens up your skin, so yeah, it helps like reduce your wrinkles.
That's interesting. Wow.
Yeah.
Excellent.
Very cool.
Well, Dr. Altenberg, thanks for coming in and sharing your knowledge with
Yes.
us. Yeah.
Thank you, Doctor.
Yeah.
He said he only goes from home to work and home, so you came here. We really appreciate that.
Yeah.
Man. Thank you.
If you guys are done having kids, like moi, vasectomies, if y'all crescendo too soon, as it's a good way of putting it, crescendo too soon.
Or if you want to have kids and can't, or whatever.
yeah. Hit the El Paso Men's Clinic.
Definitely.
And get a hold of them, pasomensclinic.com.
Mm-hmm.
And I'm sure you guys are all over social media. I'm sure very easy to find. If you guys want to look at us at our Facebook, I'm sure we're linked in there
Sure.
somehow.
We'll put all the information on the screen.
And all the
definitely.
information will be on the screen.
Thank you
Thanks
for your time.
for showing up.
Thank you, Doctor.
Thank you, gentlemen.
Appreciate
Thank you for joining us. We are the Sign Bros. Make sure to subscribe, and we're off.
Have a good day.
Sign Bros is the place where we make a sign.